Good morning, friends. Now, today I would like to share a few things with you. You know that maybe 8 years ago, one of my organizers from Germany, she asked me one question. Yogesh, are you convinced with your method? This was very nice and cute question. I answered her, yes, I'm 100% convinced that this method works. But I have to gain more knowledge and I have to study more because nothing is complete in this world. Every day you need to hold more and more information. Every patient is your teacher. And he teaches you how to talk, how to behave, everything. Now, recently, you know that it was a very hard task for Dr. Sehgal. First, to understand the repertory, understand each word from the repertory, then to apply it practically in his clinic. And he got encouraged with the result. And then he started to tell his idea to the following, all his homeopaths in Delhi. Initially, it was a shock, or they mock, or they laugh at this research. In 70s, I mean, nobody could take it that somebody can make a research in homeopathy. But Dr. Sehgal did not get discouraged. He continued his journey and tried to understand more and more rubrics. And it was really hard test. I think practically it was 1 month, sometime, or maybe more, to understand one rubric, and you need patient also to apply that rubric. So practically it was 5-year journey, initial 5-year journey for Dr. Sehgal to understand the depth of the rubric, practicability of the rubric, metaphorical meaning of the rubric, and to see the result. And slowly this journey progressed. And he came to know about more and more rubrics metaphorically. So there was many doubts. Many people still was not convinced with this research. He continued. Nothing stopped him. Then came a period that we have to popularize this method to the people around. For that, we needed youngsters from the college. So there was a group of students who started to learn from Dr. Sehgal in 80s, between 80 and 90s. And they started to popularize this idea among their own colleagues. It wasn't so, fairy. It wasn't so nice that it developed very quickly. It took 10 years for the people to first to take it, adopt it. Everybody was hesitated to adopt it. They would say, oh no, it's a one-way traffic. We can't take it. So after 2005, 1995 till 2005, they were all followers of Dr. Sehgal and only few teachers. Teachers means who could take his work forward. And in this journey, my brother, Dr. Sanjay Sehgal, and myself, we have started touring around India first, villages, very small villages, small parts, and freely, or with a small token money, we started to propagate, telling the people how to apply mind rubric. We were also learner that time, but we started to teach. Now, after 2005, there was fractions, like there are many who stayed with us, many left us because they could not understand, or they could not follow the method. They left us and they started their own classical way or whatever they learned in the past. There were few who were ardent follower, passionate follower, true follower of Dr. Sehgal. They continued the journey with my father, before the death of my father. After that, they wanted to stay with this method. So we have to move, myself, I have to study more and more because my father was not alive. And everybody was now looking, what next now? Who will be the next torch bearer? Who will carry this? So I started to write some books, whatever knowledge I had. Now, after that, what happened that few of them who left us, and then it started, a new era. A new era that the first era was when nobody wanted this method. Then the second era was when everybody was laughing at this research and they were, they thrown it in the dustbin, telling that it's useless. How you can understand a man like this only by mind? And then an era came when the fractions started happening. Now there are those followers who were very ardent, who were true follower of Dr. Sehgal. They did not, convey this method they did not forward it this method without the permission from Dr. Sehgal. Dr. Sehgal gave permission to some of the authentic students or whom he had a faith that they can propagate this method properly on, and they understood him properly. And then we also started to, we needed more teachers. So we started to propagate this, and we wanted everyone in their area to propagate Dr. Sehgal's idea properly. I mean, it's not one lecture or two lecture or three lecture, but reading the books, understanding it in the depth. Lately, I see that what happened that, okay, first, nobody wanted it. Then it was very difficult to accept it. Thirdly, then people started to accept it. And then the fourth idea came when everybody wanted to develop on the mind. So now there are in India, especially, I think 99% in India, that there are so many fractions that they started to teach on the mind rubrics. I have no problem. It's a fairly enough. They can do whatever they want to. But they are hiding behind rubrics, and they are not telling from where they got the original idea of interpreting the rubric. Somebody now they are using, like a slogan or like a metaphorical teaching, mind teaching, this teaching, or rubric teaching. But they are hesitating to tell or say or name Dr. Sehgal because they want to they don't want to accept it that it is not their idea. So I always tell all my new students, please do not get trapped with anyone on the social media, on the groups or YouTube, wherever you see somebody is telling about the mind rubrics, mind technique, mind this, mind that. Please always take care that it is from the Dr. Sehgal school. The teacher has to be from Dr. Sehgal school. See, hoarding the knowledge is not bad. You must take the knowledge from everywhere, from wherever you get. It's very good. But you have to be very careful while practicing it because you are dealing with humans. And when you are dealing with humans, you cannot be wrong. You can be wrong one time, but you cannot always be wrong. Then it's a sin. Okay, so my idea is that because all my new friends from Iran, they started to learn just now. Maybe they get trapped when they go to some social media and they see there are many videos with mind rubrics, mind days. And I don't know how they got the idea, how they reached to the mind rubric, how they understand every word like Dr. Sehgal did for 5 years. I have no idea. So with this, I finish with this opening speech. And now we carry on with the lecture of the day. Again, now today is the 9th session. Okay, friend, you know that now you already know me. You know how I teach from my experience, 32 years in this method. And you know that there are many my friends students, and they get astonished that Dr. Yogesh, we don't see. We can also work with mind rubrics. We can also try to understand the mind of the patient. But the way you do, and the way the patient respond to you, the way you extract the information from the patient so easily, this is very hard for us. So sometimes they say that you are God gifted. Maybe you understand the human more easily because maybe you are also emotional inside. Maybe you have something inside that patient tells you things very easily than to us. Now this is one of the hardest tasks in Sehgal method. Now what happens that if I there are many of my students, they tell me that when they bring a patient, they say, when you ask our patient in front of us, they tell you everything like a parrot. They speak, they tell you whatever you say. But when we ask the same thing from them, they don't answer. They don't want to tell. They shy. But we don't know how you manage it. How you manage to extract the information from the patient, and how they tell you everything. Whatever question you ask, they answer you. But when we ask the same question, they don't answer. Now, this I don't know what happens, but this is very true. I mean, to open a patient and to talk or to extract the emotions of the patient. This is the art of Dr. Sehgal method. We are exposing, we are working on the emotions of the people related to their problem only. That is the one thing. Now, it is very hard because I don't know your culture. For example, I have no idea how people in Iran, they behave, what kind of food do they eat, how they live, what is forbidden in your culture, what you can do in your country, what you cannot do in your country. I have no idea. But still you can apply my method. Still you can apply my teaching in your country. That is a part, because I'm only working on the emotional part of the patient, nothing else. That's all. And the emotions of the patient, according to me, doesn't change country to country or different culture. When a patient is talking with a doctor, he tries to give the information what is happening with him physically and emotionally. He tries to say both together sometimes separately, sometimes only he is looking or talking about the physical problem. You know, the one thing which is very amazing about patients, maybe out of maybe 90%, is very true. Whenever I start a case with the patient, first he tell me one symptom and two symptoms. That's all. Oh, doctor, I have eye problem. Okay, what is the problem with the eye? Oh, I have a pain in the eye. So he tells something about one problem. And then I ask, do you have any other problem? Yes, I have another problem, that maybe I'm not able to eat properly. Okay. Do you have any other problem? Yes, doctor, I have third problem, but I'm not too worried about it, or I don't want to mention about it now. I have only come to you for eye problem. But what about other problem? You can tell me. Now the patients only tell you the immediate problem. I mean, collectively, they don't tell you collectively all the problems they are facing. You have to probe. Okay, next problem. Yes, doctor, you know that from last 10 years, I'm suffering from this. Any other problem? Yes, from the childhood, I've been suffering from this. Now, this is one of the tasks as a homeopath, to collect first the symptom from the patient. And still you are not sure whether the patient has told you all the information or not. You are not sure. So sometimes the patient takes time to tell his symptom or tell her symptom one by one. And you need to be patient, because after you collect symptom, on every symptom you have to work separately. For example, The patient says, I don't have appetite. Now, what does it mean? It means nothing. If a patient says, nowadays I'm eating less, so what to do? Now, we have to go further. Why you eat less? If you have loss of appetite, then why you have loss of appetite? Why you are not able to eat? If a patient says, one of the easiest symptom is weakness. I mean, if you just think how many patients in your clinic will they come and they use the word weakness. Most often the patient, they use the word, doctor, I'm feeling very weak. I'm weak. Do you have a medicine for weakness? I mean, they have certain problems. But weakness is one of the things which is very predominant in a sick patient. Now, how to understand the weakness? Patient says, I'm weak. Okay, patient is weak. Weak about what? Patient doesn't know what to say. He only say one word, doctor, I'm weak. I'm feeling weakness these days. I'm very weak. I have no power. I have no energy. Do you have anything for weakness? Do you have anything for energy beside other symptoms? So patient demand is that while you will give the medicine for other symptoms, please add some medicine for weakness. So weakness, according to the patient, is a separate thing. He doesn't relate the weakness a part of sickness. So patient is taking tonic, he wants vitamins from you. He say, maybe give me some vitamins for weakness separately. I'm going to talk today about a remedy. Maybe you know this remedy, maybe you have practiced about this remedy. And this remedy name is Hyoscyamus. Okay. A big experience of this remedy I have in 32 years. Many cases, acute, chronic, every kind of case I have treated with this remedy. Last time, which remedy I talked? Anybody remember, Katie?
Cucullus.
So maybe I'm clear of the. So today, Hyoscyamus. And before that, we talked about opium. Now, today I'm going to differentiate between opium and Hyoscyamus, which is needed. Okay, and you have to be very careful because sometimes I forget to make a clear differentiation. So please be alert. And what is the rubric of opium? Alert. So I want everybody should be alert, like opium. One thing which we must keep in mind about Hyoscyamus patient is he will not offend and remain nice to his family members, friends, colleague, or people around him, as he afraid that if his condition gets worsened, then no one will refuse to help him because of his good nature. He will also take care not to offend his attending physician as well as any healthcare worker for the same reason. So the one of the information about Hyoscyamus, they always, whenever they enter into your chamber, they try to do, first thing is they are like, hello sir, how are you? I heard a lot about you. Like this. So the opening sentence of a patient is very necessary for you to keep in mind. Before you start asking the patient about his symptoms, whatever he tells you, the way he enters, the way he sits in your clinic, the opening remarks are very necessary. So the first thing which I am telling today about Hyoscyamus, that they don't like to offend anyone because they are afraid in case there is some urgency, in case they need somebody's help, then that person will not refuse because he will help him. So So that is one of the criteria. Now we have a rubric. The rubric is of stands in of those around him. So now you know that as we proceed in future classes, I will talk about some hard rubrics to understand. Now, how to understand this rubric, you need to bifurcate every word of this, every word of a rubric. Now, awe means a feeling of great respect, sometimes mixed with fear or surprise. Respect greatly and fear slightly. You know that this is very common of human being. Why do you respect somebody? Why you pay respect? Why you are, nice to God when you visit your mosque, temple? Why you have to be, there, present yourself nicely? Maybe it's a matter of respect, or maybe it's a matter of fear, especially when you are a patient and when you are trying to obey somebody, like obeying a doctor, following a medicine properly, or respecting the people around you, or have a great respect to your doctor. You are not doing because you like it. A patient will do it because of fear, or because there is some kind of nervousness, uh, and nervousness about that if he offend the doctor, then the doctor will stop treating him, or the doctor will give him wrong medicine, then his case will get spoiled. Now, if a patient is Hyoscyamus patient, when he is nice, when he tries to obey a doctor, or when he shows respect to the doctor, the idea is that if he should be nice to the doctor, otherwise it may be in the anger the doctor give him wrong medicine. Though doctor can do this or will do this, but Hyoscyamus patient always has such a fear that in case he becomes rude to somebody or offend somebody, that person can harm him. That is the first thing about Hyoscyamus. So this patient is aware of his position, that he is sick, and responsibility. So due to fear, he remains respectful whoever he thinks can be helpful to him, or he can use someone as backup. So that information you should always keep in mind whenever when you are dealing with a Hyoscyamus patient. So there is another rubric, reverence for those around him. This rubric, I talked about this rubric last session for Cocculus. Maybe I forgot to tell you in the last session that the Cocculus is a genuine caretaker and having reverence. What I mean to say genuine means that Cocculus is not a fake. When a Cocculus has a regard for somebody or care for somebody, he does it with heart. Now the other remedies which are there in reverence, they show the respect. They are kind to the people, but the reason is different. Like Hyoscyamus, when he is showing reverence to those around him, it could be anybody. Around means that those who are for him, those who can take care of him, those who have to give medicine to him. For example, a Hyoscyamus patient, for example, a husband. I'm just telling you because a husband during the sickness will be nice with the wife. He will not try to offend the wife because the wife has to give medicine to him or help him with the medicine, help him with the food. Now, Hyoscyamus patient, maybe during the normal life, he can offend the wife. But when he is sick, he will take care not to offend his family member because he fears that they may give him or wrong medicine, or they will, spoil the case. In order to, in this way, that is the reason for Hyoscyamus to be reverent or nice to people around him. So this is, you will understand now what happened as a homeopath whenever we hear about somebody's kindness, caring nature, we get trapped emotionally and we think that, oh, he's a very nice person. He's a very caring person. And you try, your image for that person changes. But as a physician, we should not get trapped with this kind of emotion. Only time is we have to contradict ourselves that there has to be some reason behind somebody to be nice. Without reason, nobody can be nice during the sickness with other person. So that is for Hyoscyamus. I hope I'm clear. Next point. Now, other thing about Hyos is they do not react in panic with the onset of the problem. And their thinking about any problem is that he will be okay and problem is not going to harm or there is no risk involved. He will not visit a doctor. The second point for a Hyoscyamus patient, you know that the words are very important in our method. The kind of word. So now today, just now, I am telling you the one word which you have to keep in mind about Hyoscyamus, and the word is risk. Hyoscyamus will not do anything, will not act in any way which can be risky for his life. Wherever there is, so wherever there is any risk involved, Hyos will escape. Now, that is the fundamental of Hyoscyamus you have to keep in mind. You know, it could be very simple. A patient will come and while giving you the case, he will give you this sentence. Doctor, wherever there is any risk involved, I escape. I don't go there. One idea can come into your mind. This patient could be Hyoscyamus. So this patient ceases to complain of his symptom. So the rubric is indifference, complaint does not. In opium, I have discussed this rubric for opium session. You see opium, Hyoscyamus, they are all, both are there. Opium is also there and Hyoscyamus is also there. As we already done opium, so I give some differentiation between opium and Hyoscyamus. As I already told you about indifference word, the word has to be very clear to us. Indifference means apathy demonstrated by an absence of emotional reactions. The trait of remaining calm and seeming not to care, a casual lack of concern. And indifferent is showing no care or concern in attitude or action, lacking importance, not mattering one way or the other way, often followed by two, marked by a lack of interest. Because why I gave you this? Because the rubric is indifference. So you have to understand this is remaining calm and lack of concern, but not lack of interest. So the initial reaction of a Hyoscyamus patient and opium, as I told you, they have lack of concern in the beginning about their problem. Opium thinks it is not a big issue. Now, the word for opium is big. The word for opium, it is not a big issue. And for Hyoscyamus is not at the level of risk yet. Now, please be careful when you are differentiating the remedies. Big and risk are the two words which give you clear idea about opium and hyoscyamus. So it means that opium will approach to the doctor when he starts to realize that he must visit a doctor, otherwise the problem will grow further. And hyoscyamus also have the initial same feeling like opium, not to visit the doctor, but only to visit the doctor when he realizes it could be risky now to his health or to his life, risk involved now. Now there is another rubric which we have to understand, indifference to suffering. Now you see friends, we don't have hyoscyamus, we have opium. Okay? Opium has both rubrics, indifference, complaint, does not, and indifference to suffering. Now, Hyos is not in this rubric, which means he will take the action for his problem when the suffering starts. So, when he knows the suffering is coming, then the Hyos will take the action. Now, what is suffering means? Suffering means any issue due to which a person gets stuck, like not able to eat, move, work, or walk. This is the problem of opium when he feels that, for example, for the last 3 days, he was not able to eat. And now when 3 days passed, and then he start to worry, if he will not eat on the 4th day also, then how? Then it would be very difficult for him to manage the life. So 4th day will be the crucial point for opium, because 3 days he can pass with calm. Same thing happened with hyoscyamus, but hyoscyamus has to take the action when he feels only the risk is involved. But opium doesn't even take care of suffering. So suffering is not important for opium, but it is important for hyoscyamus. If the hyoscyamus patient visit the doctor instantly or wait till a certain time, a hyoscyamus will wait, and the reason for not visiting the doctor or do anything for sickness varies from every hyoscyamus patient. One thing which you have to keep in mind, two patients of same remedy will not react in the same manner or will say the same thing. Maybe there are changes in the words or gesture, but they still represent the same medicine. This particular mentality is also there for other medicines, but how hyoscyamus is different from other, this we study. It means that there are many medicines, patient, initially their reaction toward the problem is to wait or not to go to the doctor. There could be many reasons why a patient doesn't want to take the medicine in the beginning. But for the hyoscyamus, because we are studying hyoscyamus today, so I only focus on hyoscyamus. So the first reason for this hyoscyamus patient not to remain calm with the sickness, rubric is high-spirited. Now, how we understand the rubric high-spirited? So first thing, there are two words. One is high and the second is spirited. So always, it means that now we have hyoscyamus and we have also opium. Both are sharing the same rubric. So the first reaction of both the remedies not to take action, not to go to the doctor, as they feel nothing to worry. Why to go to doctor so early? Let's see what will happen. Now, high-spirited is that not to demoralize yourself, always keeping a faith that things will be better, everything will be okay. How? He doesn't know. For example, when a patient, I start the case taking, and when a patient tells me that he was having the idea that he never needed medicine because nothing has happened to him for many years. He was always better. It is only the first time he suffered from a problem. Never in his life he has any problem. So the first reaction for the problem is that, okay, the problem has come because he never has faced any problem in the life. So he doesn't know how to react because he never had a problem in the life. So the first reaction is not to be sure what to do if the problem has come. For example, a patient will tell you that he never has pain in any part of the body in his life. This is only for the last 1 month. He started to feel pain in the body, maybe a particular, joint or particular organ in the or area in the body. Before that, he never had it. So it takes, it takes time for a patient to react because he never had any experience about the joint pain, which he started to suffer only for the last 1 week or 1 month. So he need time to understand what to do, why this pain is there, what can be done. If he has to go to the doctor, if he has to wait. Now, because of the previous history of no problem, the patient doesn't take his present problem so seriously and keeps a faith that the things will improve, or it could be a passing phase. It will be okay, nothing to do. Okay? So that is the problem of some patient who tell you they have never had any problem in their life, and first time in their life they have this problem they are suffering from. For example, diabetes, or for example, high blood pressure. Nobody has, okay, there are many patients, they say, okay, 30 years, 40 years, I lived without any problem. Now, suddenly, I'm diagnosed with diabetes. I'm diagnosed with blood pressure. I'm diagnosed with arthritis. I never had even one symptom in my life. So it's natural that the reaction comes accordingly to the patient. The first reason could be, this is the lifeline. Okay, what I'm trying to say, what is high spirited? How I understand the high spirited about Hyoscyamus. I understood that the rubric high spirited is just not the high, it's not only the rubric, it is the feeling. High spirited is a feeling. It is an attitude of the patient during which he adopts due to sickness, or during the sickness, or due to some disease. Now, according to my own thinking, high spirited is the lifeline of Hyoscyamus patient. Means he doesn't get demoralized with the onset of the problem and live with the idea that there is nothing to worry and it's a matter of few days, then he will get better. The fact is, he doesn't want to accept that he is sick and live with the fancy that all is well. But inside, there is a fear, but he doesn't show it. He doesn't show his worry to anybody around. He doesn't share about his feeling with his family member. Nobody will come to know that there is a symptom or Hyos is sick, because he doesn't want to demoralize himself by declaring that he's sick or he has a problem. So that means he likes to remain or live with the idea of high-spiritedness. Now, the people close to Hyoscyamus could feel that there is something wrong, but the patient keep on behaving as if nothing is wrong with him and everything is under control. In cases of children, it has been observed that they keep on telling the parents that everything is fine, even with injury. Mommy, nothing happened. Mommy, don't worry about me. I'm grown up. I can manage on my own. Now, when a child is telling you this, first thing, there has to be some kind of fear that if mummy will observe his problem, then maybe she will give some medicine, maybe she will take to the doctor, maybe she will apply some medicine to him, which he doesn't want. So the first reaction is, mummy should not take him to the doctor. Or for an adult, they don't want anybody to advise him to go to the doctor. So they don't want to go to the doctor. That is the first thing. Affectation. Now, this one of the earlier rubric, Dr. Sehgal has come about, the understanding of this rubric, affectation. Now, affectation meaning is that somebody who has weakness inside but doesn't want to show this weakness outside to the people. So there are many patients, 11 patients, they pretend. Affectation is to pretend that they are not weak, though inside they know they are weak. Like, for example, a child is going with the mother, and the mother is giving warning not to leave the hand. This is very normal. Mother tells, or the parent, they tell the child while walking on the street or while walking in the shopping mall, not to leave their hand, or at least stay around them, not to go far. But children, they don't listen. Some children, they listen. They don't go away, or they follow the instruction of the parents. But there are some children who doesn't want to follow, or who feel they are grown up and they go here and there. Now, Hyoscyamus child has the same tendency. In the beginning, they don't listen to the mother. For example, the mother tells in the shopping center to a child, don't go away, okay? I'm here, stay near me. But the child, because of his curiosity, he sees some toy, or he wants to explore something in the shopping center. He moves a little bit here and there, but not too far, but nearby. Just say about 2 meters here and there. And meanwhile, the mother, she doesn't notice that the child is not with her or standing nearby. And she moved to another counter, or another, move out of the shop. Suddenly the mother sees that the child is not there, or at the counter she realized that she missed the child. And now the child, after going some steps here and there, when he look back and the mother is not there, he gets panicked. Where is the mother? Now the first thing he was doing is, he knows that when the child will not see the mother, he comes into the panic. But when the mother was telling the child not to go, as he is small, he will lose the way, or and then he will miss the mother, then he will not listen. But when he misses the mother, then he get panic. And another example which I used to give for the children, Hyoscyamus child, when he see, for example, a dog from a distance, very far, and he is behind an iron, he's behind his door, and only he see the dog from the window. And that time, he's trying to tell the dog, hey, he's trying to project as if he's very brave to the dog. But the dog is not looking at him. Or maybe the dog is looking at him, but from the distance. And now slowly, the dog start to approach or coming near to him. When the child realizes that the distance between him and the dog is now very less, or is becoming lesser, and that time, he run back and enter into the house and close the gate. This is called affectation. Affectation means that initial reaction of the patient is to show that he is brave enough and doesn't worry about problems. But when the problems start to grow, this affectation goes away, and then he start worry and search for the treatment, how to get better. So this is called affectation. There is another rubric, affectation in gestures and acts. Sometimes there are children, when they see, for example, again, the dog is coming, they pick a stone, small stone, and throw to the dog. And the dog is still very far, very far. The mother says when the dog is very far, he starts to make a gesture or reacts to scare the dog from the distance. But the moment when he sees the dog is approaching or coming near to him, then he hides behind the mother or asks the mother to take him in the arms. And that time he gets scared. This is called affectation in gestures and acts. So the rubric, when the Hyoscyamus patient, they always have a fancies that nothing is wrong with them. We have a rubric, delusion, well, himself to be, fancy himself to be. So we have Hyoscyamus here, and we have opium. So there are 11 medicines who have such a fancy. And this is a delusion. In delusion, we have the word fancy. Fancy and delusion. So it's only a feeling that they are well, which is actually not right. They know from inside there is something wrong. Like for Hyoscyamus and opium, they already know that something is wrong happening in the body. But still, they like to wait. They don't like to jump upon treatment. They don't like to rush to the doctor. Sometimes Hyoscyamus will say, doctor, that I always think that in the beginning that this problem is not so risky. So I can wait. So delusion, fancy, this is the rubric. Second reason, first reason I gave you, which have rubrics like high-spirited. And second, Hyoscyamus is afraid of taking the medicine. Number two reason why they don't go to the doctor. Now, as I told you, there are patients who never have suffered in their life with any kind of problem. So suddenly when they suffer from one problem, they may get scared, but they don't react, or they show it as if that's not a big issue. That's not a big issue. The second point, maybe the first point is not there. When you ask a patient, when you came to know about your suffering, or when the pain started, why you did not visit earlier. Now, the second option for the patient is that, doctor, I don't like medicine. I avoid medicines. I know medicines are not good for the body. Okay. Why a patient has to think like these three things? I avoid medicine, I don't like medicine, or medicines are harmful. How he knows? Because he has never suffered in the past. He has never taken any medicine in the past. Now, from where he has made this opinion that the medicines are bad? Obviously, he has heard or he has seen some cases in his family. It is not his own idea. He has got this idea maybe from a literature, maybe he has heard from his family member or a friend, maybe he has seen some cases got worsened by medicine. So without taking the medicine, sometimes the patient, they make an opinion about medicine that the medicines are wrong, or one should not take the medicine so quickly until unless it is needed. So Hyoscyamus is the one who has this idea. How? He doesn't know. Maybe he says that I have heard or I have seen in my family, that my mother was sick and I saw that how many medicines she had taken in her life. And after that, she became bedridden. Now, for Hyoscyamus, not to take medicine comes from the bad ideas which he has collected from some practical things in his life, maybe from his family. He has seen some cases from his friend or from his neighbor, from somewhere he came to know, or he has seen this. Or maybe in the past, he had taken some medicine for one or other problem, and he suffered badly after the medicine, not from the problem itself. And that has made an impression in his mind that the medicines are bad and one should not take the medicine easily. So this is the second option for a patient, not to visit a doctor and not to take the medicine. Both. Maybe because when you visit the doctor will give the medicine. So visiting the doctor means you will get medicine and which he doesn't like. So as he thinks it will harm him, and then he has to suffer more than his present problem. Now, what is Hyoscyamus? This is Hyoscyamus. If he will take the medicine, first, taking the medicine is an issue. Okay? Why it is an issue? Because then he has to suffer more than his present problem. So the patient says, doctor, I am whatever problem presently I am having. See, I still can live with it. There is no danger with my present problem. Now, my worry is, that if I start a medicine, allopathic, especially allopathic medicine, the chances it will affect me or start to make me suffer more than what I have now. So the reason is clear. He doesn't want to take medicine. Hyoscyamus. He doesn't want to invite any other problem to his already existing sickness. Okay? He doesn't want to invite any other problem. Highest thinking is, as such, the problem is not causing any trouble to him. So let it be like this. So what is the Hyoscyamus? Let it be like this. It may happen that after medicine, his condition gets worse, then he may need to take another medicine. And with that medicine, he may suffer from another new problem. And then at last, he end up with many illnesses or end up taking so many medicines. Now, this is one of the commonest symptoms which I have heard and applied for Hyoscyamus, the worry about taking the medicine because they don't want to add more problem with the present situation, means complication. So what is the word for Hyoscyamus? Complication. Hyoscyamus patient never likes complication. To whatever, to complication, to already existing problem, that he always take care not to invite complication. Whenever he feels that there is a complication, he always has to react. So the thinking of a Hyoscyamus patient is, once he start taking the medicine, then there is no end of taking the medicine. And not only that, with allopathic medicine, if a patient start a medicine for one problem, then that problem never gets better, but there are chances a new problem will appear. And then the doctor will add another medicine for the new problem. Now with these two medicine, another new problem will appear. Then the doctor will add one more medicine, the third one. And this cycle, vicious cycle, will carry on, and then there is no end to medication. So that is the reason a Hyoscyamus patient will not like to visit the doctor, because he doesn't want to have problem in his life, never ending. And a stage will come when the doctor will tell him that now nothing can be done and he has to live with all the problem whole of his life. So then that is the worry of, so this is speculation. This is called speculation about something which has not come, which may be not true, but he already started to speculate that once he start taking the medicine, then in the future will be like this. But there is no problem. Okay, I come back to you, all of you. Have you ever experienced such a patient, or have you ever come around such a words from the patient in your life? Any patient who tells you this story, which I told you just now, that why he doesn't take medicine. Anyone? Muhammad?
Yes, we have. I have that patient, yes.
Yes, I also have. Very good. So Iran and India, same. No problem. And Bahrain, have you ever heard a patient like this? I have many patients who speak like this. Whoever practice, they must listen this thing. If you are homeopath, you will listen this. But if you are a allopath, you will not listen. Only homeopath listen these words. Because if you are a allopath, nobody tells you because you are allopath. But if you are only homeopath, then the patient will tell you why he doesn't take allopathy, why he doesn't want to go to allopath, why he prefer homeopathy. So Hyoscyamus patient, they prefer not to take medicine, but if they have to take the medicine, then only homeopathy. Because homeopathy has no side effect. Allopathy has side effect. This is in the mind of the patient. But how they understand this idea, nobody knows. From where they get this idea, nobody knows. This is their own speculation. This is their own thinking. In allopathy books, in our books, this is not written. This is the idea of the patient. And this creates a fear in their mind not to take allopathy. Okay, is it clear? This is the patient idea, not my idea. So what we are doing, we are taking the patient idea and interpreting the whole situation and using the rubric. And this is one of the commonest thing a patient tells you, very common, all over the world. Now, what is the right rubric for this? The right rubric for this is, I always give you, proper rubric, not the rubric from here and there. The rubric is complaining of supposed injury. Please understand, supposed. Suppose means which is not there, which is not present. But now, maybe you understand my words. The patients start to speculate about something which is not there, which may not happen and maybe not true. Sometimes I try to ask the patient, maybe you are wrong. Maybe when you start taking allopathic medicine, nothing will happen. You remain better. Why you have such a speculation? But this is a very predominant feature of Hyoscyamus. Now, Hyoscyamus patient, they speculate about a problem beforehand, complaining, suppose, but doctor, suppose if I take the medicine and suppose if something happen, then who will be responsible? You will be, if you will be responsible. For example, I behave like a neutral. I'm a very neutral person. Okay. I tell the patient, what is the harm in taking allopathy? You can take allopathy. It's a medicine. Maybe it will not harm you. But doctor, suppose if it harm me, if you are going to take the responsibility for it, you will hear this kind of word not only with the doctor and patient. It can happen between the family. For example, I want to give somebody in my family a dish to eat or something to eat, something I cook. Now, I speculate that, oh, it's good that I did not eat that food. It's good I did not go to that place. It's good I did not go to that place, or I did not agree with that person. It's good. So what is the suppose means? It's good I did not take the advice of that person. Otherwise, I would be in trouble. Now, this line is very clear. We speak many times. It was good that I did not go to that place. It was good I did not listen to my brother. It was good I did not eat that food in that day in the restaurant. Otherwise, I would have suffered. Have you ever listened these lines or have said to yourself? This is the rubric, complaining, supposed injury, which is not there. So he is creating. So what is a patient? A patient creates some idea on his own without any information, without any knowledge, without any study. Some patients, they talk about medicine. They talk about disease. They start to talk about sickness. How? Sometimes the patient say, I know about this disease. But how you know the disease? Have you been, you are not a medical person. You are not a medicine, you are not a health worker. How you know the disease? So sometimes it is very, very natural. The patient, they have certain images in the mind which they create on their own by little information from outside. Very little information, and they make a big tree of that. So this rubric is very nice about Hyoscyamus. They suppose if they have done something in their life would be hell. So they are very confident, doctor, it was very good. I did not take the medicine in the beginning. It was very good. Very good. I did not take the medicine. If I had taken the medicine in the beginning on the advice of my mother, today I will be in trouble. But this is only his idea. This is not truth. It may happen or may not happen. But according to him, he did a very good job. He did not take allopathic medicine. I hope this rubric is clear. Like, oh, it's good I did not learn Dr. Sehgal method. Oh, if I had learned Sehgal method, I would have been in trouble my life. So in a lighter way to make you understand the rubric, that how people are doing this all the life, you are doing it. Maybe you are also doing it. But maybe once in a life, maybe 50 times in a life you did it. But maybe during the sickness you did it. Oh, for example, somebody offer you water and you are sick and you take a sip. Oh, it's good I did not take the water immediately. It was so cold. It would have troubled my throat. It's good I took only sip, not the whole water immediately. Had I taken the water immediately, it may be my throat got affected. This is the rubric complaining suppose injury of. Well, so this is how the hard work of Dr. Sehgal to understand each rubric with the words of the patient. Now we have another rubric, refuses to take the medicine. Also one of the good rubric. We have only Hyoscyamus here, but not opium. And also in complaint, suppose injury of, I showed you the rubric. Only Hyoscyamus is here. Okay, that's the only one medicine in the whole materia medica with this kind of thinking. So you are not at risk because there is only one medicine and you can prescribe easily. Okay, so refuses to take the medicine. Now why a sick person will refuse to take the medicine? As I already told you, that the people who refuse to take the medicine, they have their own myth, they have their own speculation, they have their own information, and everything depends upon an individual. There is no two people who think like the same, but maybe there are people who have the same information in the mind from somewhere, from the family, from somewhere. So refusing to take the medicine. See, medicine, what is medicine? Number one question. Today's question number one. What is the medicine? Anyone who will answer? Simple question. What is medicine?
Something that can cure us when we are sick.
Okay. What is the broader and metaphorical meaning of medicine? So, medicine is something which is given to you to help you. Okay. Now, medicine is something like you consume, you take inside the body, and it helps. It try to heal your or make you healthy. Number one, medicine is like a substance which one person consume. It could be chemical, it could be any form of material from any material. Now, medicine in a metaphorical meaning is also advice. Advice, suggestion. These two things are also work like medicine. Like food. For example, a patient refused to eat food. Refuse to eat food. Now, what the doctor says, if you don't eat the food, you will get weak. Then you will not survive. Then you will die. Then you will never get better. So food is also medicine. Advice is also medicine. Suggestion is also medicine. So sometimes we are only limited medicine as a medicine. That is also possible. But we have to understand there are patients who doesn't like advices. But advices are given for the benefit of the patient. For example, if one mother says, my son, he never likes my advices. Whenever I like to give him advice, he says, oh, I don't need it. Don't give me advice. I know what to do. The mother says, but I'm trying to tell you for your benefit. But if I tell you not to eat this thing because you are sick, what is wrong in it? Now, I don't want it. So, when, for example, a family member advise a patient, take medicine. You have a headache. For example, a patient is having headache and he is crying, but not taking medicine. So the people around him, the mother, father, brother, sister, or wife, husband, they offer medicine. Take something for headache. Your headache will be okay. Then you are at peace. No, I don't want medicine. Because Hyoscyamus has a fear behind and speculation. Sometimes, there are patients who are coming with headache, for example, headache, continuous headache, frequent headache. And there are few patients who are suffering from frequent headache or headache from many years. You will hear that they don't take allopathic medicine always. Sometimes they take medicine when it is unbearable. And most of the time, they try not to take it. They try to manage naturally by lying down, by, balm, massaging like this, or bending something. But they're afraid of taking allopathic medicine too much. So if the patient says, doctor, there are many episodes of headache, but I only take headache painkiller when I know that I can't survive. Then only I take. Usually I try to avoid. But why you want to avoid? Now, there is suffering. What is headache? What is pain? Pain is a symptom, but pain is a suffering. Why you want to suffer from the pain? When there is a painkiller, you can take painkiller. Simple. It's very simple. Why you want to suffer from pain? Why you want to torture yourself? I tell the patient, I ask from the patient, why you are torturing yourself? When there is a headache, there is a painkiller, take it. But doctor, no, I don't want to take pain. But why you don't want to take the pain? Because doctor, you know that then it will damage my kidney. It will damage my body. Now, there are two things. Suffering from pain or fear of getting damage of the body in the future. Future and present. Now, the patient is not worried about the present. He is worried about the future. In the future, my body gets spoiled. In the future, it will harm my body. But what about the present? So, I ask the patient, why you are spoiling your present for the future? Very common sense. And why you are spoiling your present and thinking on the future? Now, who knows how long you live? Maybe you die tomorrow. Who knows? Maybe you die after 10 years. Nobody knows. It's better to take painkiller and enjoy the life. No, doctor, I will not take. Now, when you are advised, when you are talking with the patient, I always try to favor the patient and give, immediate or the nearest point of relief. Take painkiller. No, take painkiller. No, take painkiller. No. Now, when the patient keep on refusing to your idea, then this symptom become predominant. Then you have to take it. But when you advise the patient and the patient says, oh, can I take painkiller? Yes. Okay, next time I take the painkiller. So there is no fear. But the fear is predominant when you are advising the patient and telling the patient there is no harm in painkiller. You can take it. It's okay. Think about the present. Why you refuse to take the medicine? No, I will not. Take it. No, I will not. So the fear is predominant now. So always don't take the symptom on the first time. You have to, make the patient understand that the thing which is telling you, the emotion which is giving you are not true. Because he is not a medicine. He is not from medicine. He doesn't know what is medicine. He is not a doctor. But I am a doctor. So I have to tell him medicine is not so wrong as he thinks. Medicine is not so bad as he thinks. Somewhere medicines are prepared to help the humans. They are not prepared to give harm. Okay, there are some good and bad in everything. So first I try to talk with the patient at a normal level. And then I want to see his reaction. Now, sometimes the patient, he argue with me. What kind of a homeopath you are? You are telling me to take allopathic medicine? I can't believe. You are such a famous homeopath in the world, and you are telling me take allopathic medicine. He abused me. He accuses me. He fight with me. What is this? Calm down. I know everything, but I'm not a patient. You are a patient. My thinking is to tell you everything about homeopathy. Then sometime I tell the patient, okay, don't take allopathic medicine. If you want homeopathy, very good. But you know that it will take 1 year to get better. Now what you say? It will take 1 year for the headache to get better. Are you ready for 1 year? Or you want immediate relief by painkiller? I give option to the patient. Are you getting my point? This is way of my case thing. I give the option. See, if you take homeopathy, I'm not sure when it will get better. It may take time. Then what will you do? Now the patient has to think what to do. 1 year with homeopathy, and he has to suffer the pain. If he take the painkiller, then his body get damaged. Now what to do? I can't decide. So I tell the patient, I can't decide for you. You have to decide what is good and what is bad for you. Now, when the patient decide, okay, I stay with homeopathy. Okay, then I start preparing the rubric. So refuses to take the medicine. What kind of medicine the patient want to refuse? Homeopathy or allopathy? According to the patient, what is medicine? So there are patients in this rubric who doesn't want any kind of medicine. Natural medicine, they don't want. Homeopathy, they don't want. Allopathy, they don't want. But Hyoscyamus is particular. He doesn't want allopathy. He say, I can take homeopathy easily. I know homeopathy is safe. So why Hyoscyamus will prefer to take homeopathy? Because it is safe and has no side effect. If you hear this from a patient, why he likes to take homeopathy? Because it is safe and no side effect, you can think of Hyoscyamus. Okay, next part. Now, next rubric is coming, fear of being injured. A very nice rubric explored by Dr. Sehgal, first time in the homeopathy world. He understood this rubric, applied this rubric, and taught this rubric, and we got success by this medicine, this rubric. Fear of being injured. From where this rubric is coming? This rubric is coming from here. In the second part, I tell you from where it is coming. Now here, fear of being injured from this line. These are the line for fear of being injured. It may happen that after medicine, my condition get worse, then I have to take another medicine. Then from that medicine, my condition become more worse. Then I have to take another medicine. And then there is no end of my miseries, no end up of my problem. When a patient says, doctor, I know that once I start allopathic medicine, then I have to continue with the medicine. And instead of helping, I know that this medicine has side effect which never goes out of my body, and I have to suffer whole of my life. This is called fear of being injured. So the word here is being. Being means a continuous process. Never ending. Injured. Now the word is injured, which is from the past tense. So why he has a fear of continuous injury? Because already injury is there. Already injury is there. And he doesn't want that after taking the allopathic medicine, then there is no end up of this injury, which is already he is having. It will continue, he will continue to suffer that. With the fear that the medicine may give him harm, then relief, this patient will not reveal or talk about his problem with his family members as they ask to visit the doctor or take him to the doctor. That is one of the another commonest symptom of Hyoscyamus. They never like, they like to hide their problem from the family because they fear that if their family member will come to know, then they will take to the doctor and he doesn't want to take medicine. He is afraid of taking medicine. When family members start to feel or they could see that there is something wrong and ask if he's okay, then this patient will say, yes, I'm completely okay. If you feel or see anything wrong with me, I'm completely normal. I have nothing. Okay, I'm okay. Like this. So this is their attitude, to keep on telling they are okay and nothing is wrong with them. The reality about this patient, he doesn't believe in anything or anybody. Okay. Now this is the next door of the patient. Next door. He doesn't believe in anything or anybody. After getting sick, this patient will not take any risk. Risk word is very common. Keep in mind the word risk, as I always give you for all medicines. It could be with taking medicine, taking advice, changing or try new food with the job, business, or work. Now, friend, keep in mind that this patient will never take risk of doing something new in life. Whatever he is doing, in whatever condition he is, he doesn't want to make change in it. He can, for example, if he has a suffering, he likes that this suffering should be down or go away, but he would never like this suffering should become risky, or one day it will change to any other problem. In opium, we studied that he is worried about his problem to increase further. But in Hyoscyamus, he he's not talking about increase in the problem, but he's worried about the problem will change to another problem, and then to another complication, and then it will be risk for his life. So for opium, we have rubric fear of extravagance. Means anything which increase, he gets fearful. And for Hyoscyamus, anything which he thinks will be risky for his life, he will not go. So a very good rubric for Hyoscyamus is suspicious. This is the highlight rubric for there. We have 93 patients who are suspicious. Now, how to first understand this rubric suspicious? I think normally we all are suspicious with anything. For example, if a stranger will offer you something, you will take it. For example, if a stranger will say, oh, take $200 for nothing, you will take it. I mean, or some food. For example, there is a passenger sitting next to you and he offers you some food. Maybe you can say thank you, like an etiquette. But you have, what is this? Why he's giving me? Maybe it's something bad. Maybe he tries to harm me. So the first reaction of a human is to suspect. That is very natural. But we all have the element of suspiciousness. We all have some kind of suspiciousness. Now there are two words, doubt and suspiciousness. Doubt is different and suspiciousness is different. When you have a doubt about anything, you try to first understand, you try to explore the thing. When you have a doubt, you want clarity. You will study about it. You will think about it if you have a doubt. For example, I have a doubt on a doctor. Then you will explore. You will think whether you should go, or you have a doubt, you are not clear. Doubt means you are not clear. But when you are suspicious, then you are blocked. You are completely blocked in suspiciousness. You will not move. You will not try. You stuck with your suspiciousness. Now, Hyoscyamus is very suspicious. How Hyoscyamus is suspicious and how out of 93 medicines we can differentiate Hyoscyamus. For example, when a Hyoscyamus patient is coming to a doctor, number one, he never will go to a new doctor or young doctor. So that is very clear. So, for example, you are a new homeopath or just started doing homeopathy, 90% are the chances you will not get Hyoscyamus. But if you are a trained homeopath, experienced homeopath, doing homeopathy for 20 years, 32 years, the chances 90% Hyoscyamus will come to you. Number one. And also, before coming to you, Hyoscyamus will know or try to have all the knowledge about you from internet, wherever it is available. He will search about you on internet. He will talk about you from the people around you. He will try to understand if you are competent enough to handle his case. Now, what is the line of Hyoscyamus? The line of Hyoscyamus is, if the doctor is competent to handle his case, that is the one thing. Because he worries that, for example, the patient says, doctor, I always have a worry to go to a doctor because I'm not sure whether the doctor is competent or not. Because, and when I ask the patient, what do you mean by competent? See, every time a doctor is not successful, there are chances that the doctor is successful and there are chances the doctor can fail. I mean, that success is not a guarantee. But the patient says that I try to minimize the danger. So first, my idea is to go to an experienced doctor. And what is the meaning of experienced doctor? The meaning of experienced doctor is that he will not put him in danger. For example, there are patients who are coming to me. And when I ask them why you chose me, what is the reason for you to come to me, especially me? And then they tell that I have gathered the information about you. And I have come to know that in this particular area, you are the only one who have such a large experience in homeopathy, number one. Now, experience means what? Experience means that maybe when you feel that you are not able to handle my case, or there is a reaction of your medicine, then perhaps you will guide me properly what to do. Then my life is not in danger. So going to an experienced doctor means the risk is not too much. Minimum risk of going to experienced doctor. That is the exact meaning of visiting an experienced doctor. This is Hyoscyamus. Hyoscyamus will rarely or will not go to a doctor who doesn't have experience. You know that many times it is still very popular. There are old shops. If I visit around India somewhere, there are shops. You know what they write? Established 1963, established 1985, or practicing for the last 30 years. Why they say so? Why you have to write in your shop, or why you have to tell that you are 32-year practice, 34-year practice, 50-year-old practice? Why you have to tell? Because then the people believe you. Then they feel comfortable. Oh, this doctor has enough experience. Then I will be safe. Now, this is particular thinking of Hyoscyamus. He always look for something experience. So, if a patient will tell you that, doctor, in my life, I have only 2 doctors. The one doctor I was with, he died. Then it was very difficult for me to find another doctor like him, like of his experience. After 2-3 years, I came to know about you, that you are also have experience of many years. Now I have come to you. So, friend, Hyoscyamus will not leave his doctor in his life. Once Hyoscyamus start with a doctor, it is very difficult for him to change the doctor. Never. It is very, very difficult for Hyoscyamus to leave the doctor. He stay with one doctor for many years. Okay, that is very clear for Hyoscyamus. Because they are very fearful people, very suspicious. They suspect that if they go to a new doctor, perhaps the new doctor will not understand, and then his case will get spoiled. So if you hear from a patient, he said that I never go to a new doctor. I always like to go to my own doctor. Even he lives very far. But whenever I have a problem, I immediately call him. I never take the medicine from anyone. I only take the medicine from my particular doctor because I suspect the new doctor will not understand me and spoil my case. So this part may be clear to you. Suspiciousness. Next, cautious. So suspiciousness makes them cautious. Cautious means to do or to take care of before doing anything. So before they have to do anything, Hyoscyamus is also something like, opium. I told you about opium that they are alert. So whenever first time an opium patient is visiting to you, the opium patient will say, doctor, I had taken medicine also in the past, homeopathic medicine, and after that medicine, my problem got aggravated. And the same problem got aggravated so much, same problem, that it was very hard for me to tolerate, and somehow it got better. I don't want you to give me such a medicine which can bring my problem out. This is opium. Now, Hyoscyamus will also tell the doctor that in the past, he was with the doctor, he had taken homeopathic medicine, but after taking homeopathic medicine, he suffered from complication. Please understand the word. Hyoscyamus will not say the original problem got aggravated. No, nothing happened to the problem for which he had taken the medicine, but new problem appeared. New complication appeared. After that, he left the homeopathic medicine because of the complication. Now, because he has heard about me, he got good reference. He came to know that I'm experienced doctor, and perhaps I will give the medicine which will not create complication. That's why he chose me. So the difference between opium and Hyoscyamus, opium is fearful of having the same problem gets aggravated, and Hyoscyamus has a fear that instead of getting better, the same problem, a new problem may appear or some complication will occur and his life will be at risk then. Risk is a matter of Hyoscyamus. As he doesn't believe in anyone's, so it is difficult for him to visit a doctor. He is also afraid if he will fail to tell his problem to the doctor, then doctor may give him wrong medicine. He will always look for an experienced doctor, and due to this, he could not visit the doctor earlier for his problem. Even when he gets the recommendation from someone close to him, still he won't visit the doctor immediately. First, he needs to be sure that the doctor is competent, knowledgeable to handle his problem. Grouping as if in the dark. We talked about this rubric in opium, and now we are talking about the same rubric with the Hyoscyamus. Now, as I told you in opium, that grouping means not having any direction. He doesn't know which direction he should go. And the dark means no light. So whenever they get the light or somebody show the direction, they move. So opium, Hyoscyamus, they move when they get light or somebody tells them that they can go to that doctor, you can visit that doctor. Now for opium, it is very necessary to hear that the doctor which is going to will not give the medicine, due to which his original problem will increase further. And for Hyoscyamus, when he gets the light that there is a doctor who is very competent and he will take care that your condition will not go worse, then only he can visit. Otherwise, he is not sure whom to visit and what to do. Now the question is, what makes a Hyoscyamus patient to visit a doctor? As we learned that the initial reaction of this patient towards the sickness is that there is nothing serious. In most of the cases, Hyoscyamus patient told me that the reason they thought of taking the medicine occurred when they came to know that there was a person who had the similar symptom and he ignored his problem and later he died because of the sickness prompted him to look for the treatment. Now, there are many Hyoscyamus patients who have visited to me just because they heard that there was a person living in their neighbor or a friend close by or somebody who had a similar symptom like him. And he was also ignoring all these symptoms. And later he died, that he started to think, oh, it could be the case with him also. Now he must go to the doctor. Maybe something happened to him also, the same thing. Now, difference between opium and Hyoscyamus. Patient of both the medicine doesn't approach the doctor with the onset of the problem and likes to wait. Now, the opium, this patient will visit the doctor when he realizes that if he won't take the medicine, then the particular problem will increase further if he won't take the medicine. Hyoscyamus, this patient will visit the doctor when he realizes that he should take the action, as else it could lead to something dangerous. For a Hyoscyamus patient to visit a doctor is only when he worries about the consequences of neglecting the problem from a long time. He tells the doctor as the problem hasn't got better on its own, so now he's afraid perhaps there is something dangerous and later in the life it will harm him. Now this patient will start to reproach himself for neglecting the problem. He will say, doctor, I think I was wrong. I should have not neglected the problem. I should have visited the doctor. I don't know why I kept on neglecting the problem. Now, when I listened or I heard about the consequences of this problem, that I'm worried now. First, why I neglected it. Opium patient will visit to the doctor when he fears that his present problem, which he has been ignoring for a long time, will increase further if he won't take the treatment and reach to a level which he won't be able to tolerate. Hyoscyamus will visit to the doctor when he fears that his present problem, which he has been ignoring, thinking that it is an ordinary problem, is not any more ordinary and may be something serious about which he has no idea or remain ignorant for some more time. And later on, he may come to know that actually it's a dangerous disease with no treatment possible. So there's a rubric, fear, constant of everything. So there are patients, when they start to experience a problem, and it's not going away. Okay, they wait. 1 week they wait, 2 weeks they wait, 3 weeks they wait. But when they start to realize that the problem is staying in their life and not going away or not going down, that they start to fear. Whatever, everything means whatever. Another feature of this patient is not to leave any source of getting information about their problem. On his own, he may collect as much as information from family member, friend, internet, but discreetly. He will never tell anyone why he's taking the information. Means they inquire from others in such a manner that the other person will not come to know that they are asking for themselves. While looking for their problem on internet, they only read up to a level till it tells that there is nothing to worry if you have such symptoms only. If in case there is written something negative information related to their problem or symptom, they would not accept it and think that the bad information is not relevant as their symptom doesn't match with it. The Hyoscyamus patient would like to inquire about their disease, about doctor's qualification, experience, just to be sure that they get right medicine or they are with the right doctor. But while asking the doctor, they would take care not to offend the doctor. So in a polite manner, they would ask like, Doctor, if you don't mind, may I ask you one thing related to my problem? I have no doubt on your knowledge, but for my own satisfaction, I would like to know that if you had treated case like me in the past, and what is your experience about the disease I'm suffering from. Hyoscyamus patient will try to collect as much as information about doctor's capability and result, and he will do it secretly. During the case taking, he may reveal that before visiting the doctor, he made sure that the doctor is experienced and has a good reputation, gives ample time to the patient, listen the patient carefully, not money-minded. If a Hyoscyamus patient will be offered something to eat by a stranger, he won't accept it. And they offered something new by near one, still they will ask about the content. Until they are not sure or satisfied about the product, they won't eat it. So the rubric is inquisitive. Now, there may be some patient, they come to you and just you want to interview or ask that how you approached me, how you reached to me. Somebody told to you about me. Now, Hyoscyamus patients say, yes, doctor, I have made an extensive search. First, I wanted to know where I can go, which doctor, which is first I searched for an experienced doctor in this area. Then I came to know about you. But still I was not satisfied. Then I searched or looked, about you in internet. From the internet, I came to know that there are many people who wrote about very good about you, that you are a good doctor, you listen to the patient carefully, you don't, you are not the patient, you are not the doctor running behind the money, you have already cured many cases, so there is no danger in visiting you. Then I came to you. Okay, but the patient will like to know about your qualification also. Okay, doctor, it's very nicely. If you don't mind. Now, what is Hyoscyamus? If you don't mind, that is the starting line. Whenever a Hyoscyamus has to ask a question from a doctor, he will use this word, if you don't mind. Number one, if you don't mind, I know you are very good. I have no doubt about your studies. I know you are qualified. But still, if somebody will ask me that you have visited a doctor, have you noted his qualification? Have you asked about his I'm not asking for myself. When I go home, my wife will ask me the qualification of a doctor. Have you asked this question from the doctor? But I know, doctor, it's very bad to ask such a question from a doctor. What is your qualification? But still, he wants to know if you are the genuine doctor or fake doctor. If you have a degree from a qualified institution. So sometimes, the patient asks me, from where you have done homeopathy, doctor? And I ask, why you want to know this? I mean, it's none of your business from where I did the degree. No. I don't want to offend. Just, there are many fake doctors. Now, this patient will give you example. Now, example is, doctor, there are many fake people who are practicing homeopathy, but they are not homeopath. They just write, oh, we are homeopath. We have done the degree from here, but actually they have not done degree from anywhere. So I just want to know so that I can tell the people around when I go outside about you, then you become more famous. No, I don't want to be famous. So, he wants to know something from you, but in a manner that you will not get offended. That is the main priority of Hyoscyamus. But he can't control himself. So Hyoscyamus has the predominant symptom of inquisitive, very inquisitive. But there is another feature of Hyoscyamus. He will only want to know the good part, but he will never want to read or listen the bad part. For example, a Hyoscyamus will ask, "Doctor, can you tell me that what is the problem? I have a headache for many years." Number one, Hyoscyamus patient, how he starts. For example, a migraine patient or a patient with headache. Okay. The patient start like this: "Doctor, I have a headache from many years. I have never been to a doctor. Whenever I had headache, I would take something normal. I would lie down. I never took painkillers. Sometimes I take something, but never painkiller." Now the reason to start the treatment, that one of my friend who had the similar kind of headache, and later on he got diagnosed that he is suffering from brain cancer, brain tumor. I came to know that he died because of brain tumor, but he was also having the headache from many years. And then I got worried, maybe my case is also like him. Maybe it's also a brain tumor. But doctor, do you think I have a brain tumor? Now, as a doctor, I tell the patient, how can I know you have a brain tumor? Just by knowing. I mean, from outside, I can't judge you have a brain tumor. If you are worried that you have a brain tumor, then go for CT scan. Make a scan of your head. Then we come to know. No. I just want to know. I just want to know from you, from your experience, what do you think? Is a brain tumor or only headache? I can't answer like this. If you think if you are worried that your headache is because of brain tumor, then you must go for investigation. But if you just ask me like this to tell you if your problem is brain tumor or just a headache, I can't differentiate like this. Now this patient gets stuck. Okay, you give medicine. Now Hyoscyamus is very inquisitive, like this. He wants to know, but secretly. So doctor, tell me, what do you think about my problem? This is Hyoscyamus. When a patient asks you, doctor, what do you think about my problem? Is it dangerous? Now the doctor says, how can I say it is dangerous or not dangerous? I can only see by investigation. Go for blood test, go for X-ray. Then only I can say whether it's dangerous or not dangerous. Only by symptoms I can't tell you. Now Hyoscyamus is not willing to go for X-ray. Hyoscyamus will never go for X-ray or CT scan. No matter how much you force. So on one side, Hyoscyamus is inquisitive. On the other side, he doesn't want to go for investigation. He likes to collect the information, but when it comes to go for investigation, he escapes. No blood test. Now, it is good that we have Hyoscyamus patient. Very good for homeopathy. Homeopathy is surviving, or homeopaths are surviving because of Hyoscyamus. Hyoscyamus is very good market for us. If there is no Hyoscyamus, our income will go low. It's good people are Hyoscyamus. Why? You know that most of the Hyoscyamus, they are not coming to homeopathy because homeopathy is good. Homeopathy is safe. Homeopathy has no side effect. This is not entirely true. Why they are coming to homeopathy? Because in homeopathy, we don't need diagnosis. That is the thing which brings Hyoscyamus to you. When a Hyoscyamus is telling you, oh, you are a good doctor, you are an experienced doctor, this is all false. But the main reason Then when you tell the patient, okay, I'm writing blood test, I'm writing X-ray, I'm writing you go for CT scan. Why, doctor? Why you want me to go for CT scan? Why you need blood test? Because you are asking me, or I also want to know your problem. I'm not sure what is your problem inside, why you are suffering. What is the paper? I have to know. But you are a homeopath. Why you want to diagnose? But I'm a homeopath, but I want to know what I want, what I'm going to treat. What is your main disease? I'm not going to prescribe the medicine on the disease symptom or disease. I will prescribe the medicine on your symptom. That is true. But still, I want to know your problem. Oh, I never thought that in homeopathy you need diagnosis. Now, this patient is gone. Now he is worried. Why you need diagnosis? So, Hyoscyamus patient will never go to the diagnose. Why? He will never go to allopathy. Why? Because they worry the doctor may tell something dangerous about them. Now, Hyoscyamus say, some Hyoscyamus patient, they may go for investigation, but they never see the report. Never. Some patient, they say, doctor, I got the report from the laboratory, but I did not open the envelope. Now you see what is my problem. So to catch Hyoscyamus, one day, for example, a patient brings you investigation, a file or envelope with investigation, and the envelope is closed. Okay. Now you understand that the patient has not opened the envelope. So the simple question you can ask, have you seen the report? Have you asked the laboratory what is the problem? No, doctor. I didn't ask. I just brought the report to you. And don't tell me what is there. This report, because you asked me for the blood test, you look into the blood, you look into the report, but don't tell me what is there. I don't want to see. Have you ever saw such a patient who said, no, I don't want to see what is in the report? Because if I see something is wrong in the report, I will collapse. Now, there are patients who have heart problem. They ask, doctor, do you think I have a heart problem? Maybe. I'm not sure. You have to go for ECG, or you go for CT heart. Go for some investigation. No, doctor. I think you give medicine. It's okay. I'm just asking. No, go for ECG. No. No ECG. Why? But doctor, if something comes wrong in the ECG, I will die on the spot. So this patient will shiver to know about their problem. They shiver. No. So on one side they are inquisitive, and on other side they have rubric shuns light. They don't like to have light about their problem. So inquisitive remains there even after the case taking. They may inquire the reason for getting medicine if the doctor has listened them properly and noted all the symptoms who is preparing the medicine and pharmacy. As the patient afraid to do or act before getting the proper knowledge, but on the other side, when asked to go for investigation like blood test, X-ray, he shows hesitation about it. The usual answer of a Hyoscyamus patient is, doctor, in homeopathy, diagnosis is not important. So why you need to go for investigation? And the reason for them to choose homeopathic treatment is because for prescribing medicine, diagnosis is not needed. He will not say directly, but indirectly he would ask the doctor if it is really necessary to get investigation done. Now, this point you have to understand. The Hyoscyamus will ask the doctor indirectly if it is really necessary to get investigation done. The fact is, Hyoscyamus likes to know about his problem, but doesn't want to see it in a real sense. He gathers information which is in his interest, He doesn't want to get investigated with the fear that something may come in the report. So the rubric is light shuns and answer evasively as he doesn't want to discuss on the topic he fears. This rubric is added by us, by Sehgals. This is not a rubric in the repertory. Answer evasively as he doesn't want to discuss on the topic he fears. Now, what is the rubric? You know, what happened that I pushed the patient. I think it's better we should go for investigation. I need some tests to be done. Now, he will not listen to this. He will not listen. Now, he will say, but doctor, you know that my appetite is okay. But this is not, I'm telling you your appetite is okay or your appetite is not okay. I'm telling you that we have to go for investigation. But doctor, I don't smoke. But I'm not asking you smoke or you don't smoke. So Hyoscyamus patient will not like to answer those questions about which he is not comfortable. He remains evasive. He'll answer you something else, which is not relevant. So whenever you ask something that, especially for investigation, whenever you ask the patient or try to tell, for example, the patient asked you, doctor, do you think, now listen, see the face of Hyoscyamus, how he is talking. First, do you think it's a brain tumor? Now the doctor has not answered yet. But what is the reaction of Hyoscyamus? I don't think so. Yes, really? Now, he's already trying to tell the doctor he's not suffering from brain tumor. Okay, so he wants to know, but he doesn't want to know. That is the problem of Hyoscyamus. He will ask the question, but doesn't want answer. And sometimes when you question the patient, he doesn't want to answer. So this is very typical of Hyoscyamus, both sides. He is very evasive about answering the question. Now, this is a contrast symptom, as on one side, he likes to update or gather as much as information he could get from many sources. But when doctor asks the patient, probably due to inquiry from patient regarding the cause of disease, then this patient will try to escape from such procedure. The main reason is Hyoscyamus is afraid of seeing the reality. When asked why he is so afraid of investigation, patient may say in case something wrong will come in report, then he may die due to bad information than disease itself. If the doctor asks him that for the treatment it is necessary that he should get investigation done, he may ask, doctor, I think first you try medicine, and in case there is no result, then maybe I go for investigation. Now, till now, we have studied that there are two predominant factors upon which Hyoscyamus can be prescribed. One is trust and another is risk. Hyoscyamus will not trust anyone, even his mother. For example, I have prescribed many small children Hyoscyamus, because of the trust. Now, what happens that during the sickness, in the past, whenever, for example, a child gets sick again, okay, again. Now, the first time what happened, the mother gave him a syrup for the fever on the spoon. And the syrup was bitter. But he took it because he did not know the taste of the syrup. And he took it. Now, the second time, when the same child got sick, he will not, the moment the mother touch, oh, you have fever. No, mommy, I have no fever. No, no fever. Or maybe the child has, the mother says, oh, you have cough. No, I'm not coughing. See, where I'm coughing? I'm not cough. I'm okay. See, I'm playing. I'm okay. Now he tries to divert the mind of the mother that he's okay. Now the mother says, no, you are not okay. I have to take you to the doctor. Or you need this syrup again. Now he start crying. Now he will not open the mouth. The mother says, I have to force the spoon in the mouth. He will not take it. Or the moment he see the spoon, for some time, now Hyoscyamus child had one experience, bad experience of the medicine. Next time, just like that, the mother take the spoon in the kitchen for something else, normal. Mother, why you took the spoon? I'm okay. The mother says the spoon is not for you, for the cooking. No, mother, I'm okay. But child, the spoon is not for you. I'm trying to eat the food. But mother, I'm okay. Now he will not listen why the mother took the spoon again. Because he's afraid that she will give with this spoon the same medicine which was bitter. Now what happened that maybe after a month, the mother want to give some pudding, something very nice to the child with the spoon. Now he's afraid of spoon so much that he will not take anything from spoon. No, what is there in the spoon? But this is pudding. No. Now he suspects the mother, maybe she is giving the medicine with the pudding, with the sweet. Now he will not take it. No. Mother said, taste it. It is not medicine. No, he will not. Okay, mother say, I taste it. Okay. So mother say, see, this is not medicine. This is pudding. Try. Now what he will do? Or he will ask the mother, first try yourself. And the mother will try. And he is looking at the mother, if she's still alive or dead. So when he makes sure that the mother is alive, then he will take it. So you know that I used to keep sweets in my clinic, sweets for only Hyoscyamus, to understand Hyoscyamus. When a child is brought to your clinic, okay, and you suspect he's a Hyoscyamus, offer him a sweet. Okay. Now what happened? The child, first thing with the Hyoscyamus child, he will never leave the mother. Never. Second thing, he will always sit on the lap of the mother. When you offer a Hyoscyamus child to sit separately from the mother, he will never. He will always sit on the lap of the mother and stay close to the mother. Okay. And now, for example, I pick something from the table, or I'm doing as a doctor, I look something here and like this. And now the child will look at the mother. What the doctor is doing? He will say he will ask the mother, what the doctor is doing? I don't want injection. I don't want injection. The mother says the doctor is picking the pen. It's pen. It's not injection. No, I'm a good boy. I'm a good boy. Doctor, I'm a good boy. I say, okay, I'm not giving you injection. You know, I give you sweet pills. But doctor, I'm a good boy. I know you are a good boy. I will give you sweet pills. Doctor, I also obey my mother. I know you obey your mother. And now, again, for example, I pick something else from the table. Why is picking this? Or for example, the doctor is searching. You search something. The child will look what you are searching. Maybe injection. So Hyoscyamus child is afraid of injection. He doesn't want injection. Now what happened? You offer toffee to the child. Take it. See, it's a sweet. Now he will look. Now this is the reaction of the child. Now you say, come on. Now you see what his child is doing. You offer the sweet again. Take the sweet. Hello, take the sweet. He will not see the sweet. He will look here and there. Mummy, let's go home. Mummy, let's go home. Now, this is again, let's go home. Let's go home. He doesn't want to stay in clinic. Mummy, let's go home. Now the mother says, see, doctor is giving you sweet. What a nice doctor. He will not listen to the mother. No. Now I ask the mother to take the sweet. Now mother take the sweet. See, the mother say, I have sweet. Take it. He will not take. Then the mother open. Okay, I eat first. He will see. The mother, see, nothing happened. It's so nice. Then he will take little bit. And then he take the whole sweet and put in the mouth. So what is the first reaction of Hyoscyamus? Adult as well as children. Whenever you offer them something, they don't take it immediately, number one. Number two, when they have to take it, first they want to taste it. Little bit. Now only on the tongue. Here. Not in the mouth. If they are convinced it is safe, then they take it. Now this is the example many elders can do. Many people do this. When you offer them their Hyoscyamus tendency, they don't take the things immediately. First they try to taste it. And the children, mostly they do this. They don't take things immediately. First they want to try. So the mother says, sometime doctor, I bring chocolate. First time, new chocolate, to make my child happy. But when I offer him toffee, which he has not seen before, then he will not take it. First he wants to taste it. But if he knows the toffee, if he knows the thing before, then he will take it easily. Have you ever seen such things? Have you ever heard or seen such people? Yes or no? Who tried little bit?
Yes, yes. Yes, we
So
see.
they are Hyoscyamus. Everyone. So you have so many Hyoscyamus around you. So whenever, for example, if you are Hyoscyamus in your home, your husband or somebody, your sister, if you know that whenever you offer them something new or you cook something new for your husband, for your family, first they want to taste it. Can I have a taste? Little bit. And the taste is not like this. No. The taste is like this. Then this is Hyoscyamus. Not to put the whole spoon in the mouth. That is not Hyoscyamus. Okay? Only on the tip. That is the one condition. Very clear Hyoscyamus. And this is what the children, they do mostly. They are very afraid of injection. Doctor. Now, another information about the children is that when they get sick, number one, they keep on playing so that the mother will not judge they have problem. They know they have a problem, but they don't want the mother to know this. Now the mother says, oh, I have to take you to the doctor. No, Mama, I'm okay. I'm okay. I don't have a problem. Mother say, no, we have to. Okay, we are not going to doctor. Okay, we go to our friend house. I'm taking you to my friend house. Mother is playing the game. Now when the mother leave the house, the child will see in which direction she is going, right or left. Left is to the doctor and right to the friend. Now the mother take the left turn. Mommy, why we are going to the left? But the friend is on the right side. No. First we go to the market and then we go to the friend. Okay, but he is looking at the window. And then the mother take another turn, which is going to the doctor. But Mummy, this is the way to the doctor. You telling me we are going to the friend house. We are not going to doctor. Now, Mother is coming to very near to the doctor clinic. And now he start crying. I told you, I don't want to go to the doctor. I don't want to go to the, I'm okay. Now he start crying before entering the clinic. So before entering the clinic, if child is crying, it's a Hyoscyamus. The mother says it's very difficult, doctor, to give him medicine. It's very difficult to bring him to the doctor. He start crying before taking the medicine. And now another thing, when a Hyoscyamus child gets injured, he has a wound. Okay, the first thing is when he gets injured and there is a blood, he will try to hide it. He has a pain. The moment he sees the mother says, why you are keeping your hand like this? Nothing. Everything is okay. What about the other hand? Nothing. Oh, you have injury. Let me put something on it. No, no, no. I'm okay. Mother say, no, I have to put something, some ointment on it. No, 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 no. Now the mother brings ointment. Now the Hyoscyamus child will say, I will put. Give me. Mummy, give me. I will put the ointment. Now, how is putting the ointment on the wound part? See, now the mother gave him some tincture on the cotton or ointment. And this is child finger. And child take the cotton from the mother. Now, this is cotton with the medicine. And this is the finger injured. He has not put it yet. But what he is doing? Now, this is the injury part. Okay. Now he's putting cotton here. And side by side, what he's doing? The mother says, you have injury here, not here. I'm putting. Wait. But he's not putting exactly here. And somehow, when mother says, okay, now I will do. Okay, okay, I'm putting. The mother says, do it properly. Do it properly. Other I will put it. Okay. Now, this is the reaction of Hyoscyamus. So it's very difficult for the mother. I understand this is Hyoscyamus. Sometimes I tell the mother exactly like this. The mother says, how you see this? I say, I know how the Hyoscyamus child behaves. Now, another problem is with the Hyoscyamus children. That sometimes the mother convinced them, you know, we are going to a homeopath. He gives you sweet pills. You know it already. Then he can come. Now what happened? But unfortunately, in your clinic, there was already a child. And that child, when he went outside, he was crying for some reason. Now the Hyoscyamus child see this child crying while going out. Now he gets afraid. Mommy, why he's crying? What happened? What the doctor did to him? The mother said, nothing. Nothing happened. Now, sometimes the children, when Hyoscyamus children, when they enter into my chamber, very easily, because they know I give them sweet pills. Now, what I do? I play with them. So today again you have a problem. So what do you want? Sweet pills or bitter pills? Oh, you give sweet pills always. No, no. I can also give bitter pills. So what do you want? Bitter pill or sweet pills? Now he's afraid little bit. What is this? No, no, sweet pill. No, take bitter pill. Today I give you bitter pill. Mummy, let's go home. Mummy, you say the doctor always gives sweet pills. Now he's talking about bitter pill. Oh, Mummy, no. Now he's gone. Now he wants to go to the house. So Hyoscyamus child will never like to have something bitter. Bitter is not good. Sweet he can take. But that also after tasting, after knowing, then he's easy. So this is the example of inquisitiveness, cautious, and trust. Trust is very and risk. Hyoscyamus will never take risk in his life. Now, a Hyoscyamus will not like to change anything or trying any new thing which may cause him harm to his present condition. Although his present condition is also not good, but he would ask the doctor not to prescribe medicine by which there would be risk to lose whatever situation he has in the present situation. So he doesn't want to change the present situation wherever he has. He doesn't want to have a new situation. A Hyoscyamus patient wishes will not take risk to lose whatever he has in his hand. Even he won't like to take or accept anything, even if it's better or more comfortable than whatever he has. If offered a very good job, very lucrative position in office, expensive food, he would say, I'm happy with whatever I have. Firstly, he gets suspicious on the person who is offering such an expensive thing or offering him something more valuable than what he has presently, as he fears that it could be a trap and he may lose his present assets. Secondly, he would think what he will lose, whatever he has, due to the greed, so he will not try to take the risk. So the rubric is bad desire to remain in, number one. And the second is fear of being betrayed. This is the rubric, fear of being betrayed, for which we have to be thankful to Dr. Sehgal. He was the one to decode this rubric or brought this rubric to the homeopathic world. Fear of being betrayed. This is one of the hallmark rubric of Hyoscyamus, fear of being betrayed. So Hyoscyamus is playing the whole situation of Hyoscyamus between the two rubrics. One is bed desire to remain. What is bed? Bed is not a furniture. Bed is a comfortable situation wherever a patient feels comfortable. For example, I as a patient, when I become a patient, okay, now I am dealing with one kind of a trade. So when I become Hyoscyamus, maybe before becoming sick, I was very much open-minded. I was very much open to the new adventure. I was very much ambitious and open to new things. But once you become Hyoscyamus patient, you stop being adventurous. You will never add anything new in your shop. You only will do the same thing which you know already. So Hyoscyamus patient never like to change the things because he never want to take risk. Number two, Hyoscyamus will never gamble. Never will gamble his money. He always save the money for the risk. Now, for example, when I ask a Hyoscyamus patient that, for example, you have $100, somebody will ask you to invest your money, maybe your brother, and this money will get double after 2 months. Or there are chances that this money will disappear. You will gain nothing. You will lose all the money, or the chances are the money will get double. Do you prefer this way? He will say no. So Hyoscyamus will only prefer if the money will double, at least he will get his money back, not even double. So he's not greedy about trouble, but he's afraid of losing the money. So Hyoscyamus, you will never come across a Hyoscyamus patient who has a liking for lottery, for gambling. So in case there is a patient who says, doctor, I never go for gambling, I never take risk, and you are not giving Hyoscyamus, so please think of giving Hyoscyamus, because Hyoscyamus never take the risk of whatever possession he already has. He never want to lose whatever he has. Okay. Now there are many people who are not happy in relationship, who are not happy with relationship in marriage, especially in marriage. For example, a man not happy with marriage. A woman is not happy with marriage. But they are not changing the partner. They are not taking the divorce. Now, for example, a lady, she is suffering. She has a problem with the husband. I give a simple solution that take divorce. Go away from your husband. Leave your husband. She said, doctor, this is not the problem. I can leave my husband. I can take divorce because I'm not happy with this man. But I'm afraid. What is the guarantee? I'm afraid. What is the guarantee that another man, if I choose, will be the better than him? Maybe I get another man worse than him. So that is the fear. For the Hyoscyamus, the fear is that even when he wants to change something, maybe that he will get the things worse than what he has, than the better. So he likes to stay whatever he has. He doesn't want to compromise. So Hyoscyamus will never compromise with whatever he has. He never compromise with his health. He never compromise or afraid of complication. The word complication is very important for Hyoscyamus. He never likes to have complication in his life. He said, doctor, I'm happy with whatever problem I have. I'm happy, but I don't want to spoil my case further. I don't want complication. I'm happy with whatever I have. So Hyoscyamus will ask you many times, doctor, are you sure the medicine which you are going to give me will not create any complication? You must understand he is Hyoscyamus. Now, when you give Hyoscyamus, it is not true that he will take the medicine immediately. Sometimes the Hyoscyamus will not take the medicine. He will keep the medicine. Maybe after a week, maybe after 2 weeks, he will call you back and ask you, doctor, are you sure the medicine which you have given me is for the same disease? And you can say, yes, I'm quite sure. I'm sure, 100%. Not 100%, but yes, 80% I'm sure. So doctor, you are not 100% sure. See, I can't be 100% sure. I can be 90% sure that this medicine will help you. Oh, doctor, you are not 100% sure. At least give me guarantee. At least give me guarantee that no harm will happen. Well, how can I give you guarantee? I can't give you guarantee. But doctor, please. So Hyoscyamus cannot start the treatment till the patient will not give him guarantee. He wants the doctor should give him guarantee that nothing harm will happen. Then he will take the medicine. So when you listen from the patient who asks, doctor, I'm not going for surgery because the surgeon is saying that the operation will be successful up to 50% or 70%. So I'm not going for surgery. I will only go for surgery when the doctor will tell me or the surgeon will tell me that I give you guarantee that nothing bad will happen to you. Then only I will go for surgery. So a Hyoscyamus patient will take your medicine and ask you before taking the medicine if you give guarantee that I will be better. So fear of being betrayed is a highlight rubric of this Hyoscyamus. He always has a fear that he may lose something. Losing is very bad. Risk is very bad. Complication is a very bad thing for Hyoscyamus. So friend, with this, I finish this session of the day. Next time, in the beginning, I will show you Hyoscyamus video to you, a child video and cases of Hyoscyamus in the first.
Sir, I have a question. Here in the rubrics of Hyoscyamus, always they say that he wants to be naked.
Yeah, I know, but not
to be naked.
Not directly naked. Not that he's taking
but
away the
I
cloth.
mean that how can we see this in the mind rubrics? Wants to be naked.
Okay, the naked means that when a new patient is coming, Hyoscyamus, to your clinic, the first thing they will like to hide their problem and not to exaggerate their problem, so that the doctor should not take them so seriously. Number one, he will like to have information about their problem, but doesn't want to see it. Number two, now the third thing about Hyoscyamus is that they have information that for homeopathy treatment, a patient needs to tell everything about themselves to the doctor. Now, what happened that when this patient comes to you, he may start the case that, doctor, I must tell you one thing. I'm a chain smoker. I'm a heavy drinker. Or you know that I like to eat sugar, or something which they should not do, something which is not good for them to do, and Hyoscyamus is doing it. But they want to tell this to the doctor. This is called naked want to be. Now, naked want to be means that to tell something about which nobody from their family know about it. No one, not even their friend. So when a patient tells you, doctor, today I'm going to tell you something which no one knows, not even my mother, not even my wife. I have been married for the last 20 years and I never told this information to my wife. Nobody knows about it. First time I'm telling you that, doctor, you know, the reason of my problem is that I have done something wrong, this, that, something, which is very shameful. According to him, very shameful. And nobody should know about it, I know. But today I want to tell you because you are my doctor. And if I don't tell you, you won't be able to understand my problem. And then I won't get the right remedy. I won't get the right remedy from you. So this is called naked wants to be. Now, naked wants want. So the rubric, the word is want, not desire. Why there is a word want? Because it is a must. Whenever you have the word want in the rubric, it means it is a must for the patient to do it. Whenever there is a word desire, then this is not necessary for the patient. It is just a desire is only a wish which can or cannot be fulfilled. But want something without which you cannot survive. Like I want water. When you say I want water, or when you say I desire water, they are two different things. When you say I want water, means you can't survive without that. But when you say I desire water, it means you can survive without it. But if you get it, it's good for you. So the rubric is naked wants to be. So want means that it is necessary. He should be naked or tell everything what is the problem. There is another rubric, Mr. Yadulala, truth tells the plain. There's another rubric, truth tells the plain. Okay. And there is a third rubric, reveals secret. So now there are three rubrics I gave you. You ask one, I gave you two extra.
Yes.
So you see how good I am, how good teacher. I'm a very good teacher. You ask one, I gave you two extra. So what are the three things I gave you? Naked wants to be, truth tells the plain, reveals secret. So Hyoscyamus has to do this only to the doctor, nobody else knows. Okay, so the patient may tell you, doctor, honestly, I have to tell you one thing before you give medicine. You know, I'm a chain smoker. Maybe it's important for you for giving medicine. For giving medicine, he's not telling you just to inform you. He's telling you so that you can find a good remedy for him. Otherwise, the remedy will not help him. Okay? Thank you very much.
Thank you also very much.